let me put that same question to Dr. Stanley Perlman. Is this at this moment China's headache, or is it just a matter of time before this becomes the world's nightmare? Secondly, there's a big New Year break coming. Many people would be probably traveling out of India, within India. They'd be watching you and wondering, is there a need to reconsider plans?
Yeah, so I think in answering the second question first, I think I agree with the previous speakers that for high-risk populations, people have to be very careful, because at least in the U.S. we have co-circulating influenza virus, SARS-CoV-2, which is the cause of COVID-19, and also RSV. So all of these are particularly dangerous for people who are over 80 years of age. So these people just have to be cautious, and they have to be protected from others who might spread the disease. In terms of whether the virus in China will cause a world additional disease, it's just really hard to know, because as has been said, everybody pretty much in the rest of the world has either been infected or vaccinated. But the three groups we really have to think about are the old people, people who are immunocompromised, and the small population that has neither been infected nor vaccinated.
Dr. Shamika Ravi, let me get you to answer that question, because that's really, frankly, as I was preparing for the show and as the social media posts went out, that was the first question. Yes, China is badly off at this moment. People feel bad for the fact that there are so many suffering, but they're saying, "Hamare New Year plan ka kya hoga? Boss ye batao. Do we need to reconsider the plans? Are we okay?" So many are traveling to places like Indonesia, Thailand, elsewhere, and are wondering, could they potentially get stuck? Because this has happened in the past, and they're wondering, could it happen again?
Well, I think this is where we have to listen to the doctors and the experts, the scientists. And but Rahul, unlike in the past, where we needed time to ramp up infrastructure, and readiness, etc., now we know it's not an unknown virus, right? The strain might be different and perhaps more virulent, but we know what has to be done. And I think while there will be protocols and there will be measures that the government is going to pronounce, etc. But I think people by and large, if you look at Google mobility data and all, you realize that people are very perceptive and they respond in ways which is absolutely commonsensical and rational. And once again, that just means that the more information local governments and governments share with its population, I think the better the outcome. Just having more transparency around data, just having more discussions, sharing of information is just the best way to tackle a problem like this.
Giridhar Babu, I want you to answer the question about what happens to the rest of the world. A, many countries more vaccinated and therefore more immune, and quite a few citizens have also had some variant of this virus and therefore not as untouched as the Chinese people are. But the possibility of mutations coming out of China spreading elsewhere, is this China's nightmare scenario, or could this be the world's headache in the new year?
That's a great question, Rahul. The last time, in the beginning of the pandemic, when the rest of the world ignored China's initial outbreak, we had to pay a huge price of multiple waves thereafter. So I wouldn't take the outbreak in China, the current wave, lightly, mainly because A, the new variants might emerge out of it. Two, we have got other issues that we need to take care. I'm extremely happy with the response in India. We are in a better position. That's a good place to be. But then if there is a new variant, then the wave will occur only among the elderly. And currently, if you see the booster dose or the precautionary dose coverage among the elderly is only 50%. And if you take all the adults, it's only 1 in 5 have the booster dose. So this is the time for us to not take things complacent, but make sure that the booster coverage is expanded. Surveillance is strengthened with genomic sequencing, which is already done by the government of India, and several state governments have started the work on it. And finally, as a globe, we need to get our act together. It's not China's problem alone. We need to strengthen surveillance in all parts of the world. We need to ensure vaccine availability in all parts of the world. I feel that's where India's leadership is also critical. Professor Shamika has already stated earlier, using G20 as an opportunity to build coalitions to ensure that many countries are thanking India for the sharing of the vaccines. But you can't do by one country for all the countries. So there should be a coalition which will take care of the inequities in health